It's a pleasure and an honor to work with the fellows. We take 2 fellows per year. This is an ACGME accredited fellowship where the fellows work very closely with 6 sports staff surgeons to learn and to hone their skills with knee, shoulder, and hip arthroscopy in sports medicine.
We have a very robust sports coverage responsibility and privilege in San Diego County. We're incredibly large, hundreds of thousands, over 500,000 members, patients that we're responsible for. So essentially any student athlete in San Diego County who's a member of Kaiser Permanente, it's our role, responsibility, and privilege to take care of them.
We are looking for fellows who are seeking out an active experience during fellowship. There are no rotations. There's very little observership in the fellow. The goal is to have the fellow run their own clinics and to operate and be hands-on. So we are looking for fellows who are looking to actively participate in the clinical and surgical care of sports patients.
We're able to provide an environment where the fellows have a lot of autonomy. So they have their own panel of patients. They have the longitudinal follow-up and care for those patients who sees them as their surgeon through the year. Having that longitudinal care we feel is a very important educational piece that we feel we're able to provide well here in San Diego.
But I do want to point out that one of the unique features of that is there's lots of supervision. Every single patient that a fellow sees is also assigned to an attending. Every single patient that a fellow operates on is either operated on with an attending, which is how it is for most of the year, but later in the year, the fellows may operate independently with an attending in the other room, and yet that attending is still ultimately responsible for that patient.
And that's what I really love about the fellowship. I get to see my own patients under the supervision of the faculty. I can run stuff by the faculty, but at the same time, I'm the one making the decisions about the patient care, when to take them to surgery.
We treat our fellows more as colleagues rather than as residents who actually do our work for us. And so, we discuss cases together, we work together, and they're almost like young associates that we're working with.
Having that autonomy and having that graduated level of experience sets you up for going out into practice.
Our fellows truly hit the ground running when they graduate from fellowship.
And that's unique. There aren't a lot of training programs that are able to provide that.
When I was applying for my fellowship, I took into consideration the fact that they offer me a great opportunity to do my own cases, to use any hardware I wanted to use or any techniques I wanted to use. But also I had exposure to enough difficult or complicated cases with the adequate mentorship.
All of our staff considered it a pleasure and an honor to work with the fellows. We love what we do as sports surgeons, but we especially enjoy our work when we get to work with the fellows. It enriches our experience, and that's the philosophy of the group, that fellowship should be an enriching experience for both the fellow and for the staff.
What that looks like during the week is the fellow will have their clinic supported by the supervising attending physician, but otherwise the patient and the fellow develop that relationship, including evaluation, determination of either operative or non-operative care, indications for surgery, taking them to the operating room when indicated, and following them through the long, often complicated follow-up process involved in sports medicine care.
Thursdays are dedicated for fellowship work. We meet in the morning for a 2-hour conference. The first hour is dedicated to discussing some sports medicine topic, and the second hour is an indications conference where we have one of our musculoskeletal trained radiologists join us for that conference, and we discuss x-rays, MRIs, surgical indications, surgical plans, etc. And then we all head to our acute sports clinic injury, where we see acutely injured patients from throughout the San Diego County for a variety of sports surgeries, including multi-ligament knee injuries, ACL injuries, patellar instability, shoulder instability. Afternoons on Thursdays are dedicated to hip arthroscopy or hip clinics.
One of the aspects I also really love about the program is the sports coverage. We take care of our own football team from the start of the season to the end of the season.
And our fellows are deeply and intimately involved in that care. They will cover high schools. They also will be part of the professional sports coverage. But we really make sure that it's not a burden to our fellows. We don't want the experience to become overwhelmed with the responsibility of the student-athlete coverage or the professional sports coverage.
So the support you get here has been pretty great. You get a laptop and the iPhone, which kind of integrates the whole Kaiser epic system onto your phone.
It's something that we've really enjoyed kind of taking to another level to be able to provide excellent virtual care to our sports patients.
The resources are amazing. I always felt that I have plenty of resources to get more education and to become a great surgeon. I totally recommend this program to anybody.
San Diego is a fantastic place. Obviously the weather is amazing.
It's a beautiful city full of things to do outside, surfing, playing tennis, any other sports that you want to play. There's going to be plenty of opportunities in San Diego. Food is great. People are super nice. I love my time here at San Diego.
Finding areas to live in San Diego is very easy. There's plenty of locations that fit everyone's lifestyles and needs.
San Diego is a wonderful place to live and work. The beauty of San Diego is that we get to play sports all year round, and we get to take care of our athletes all year round. We believe that we provide the fellows with an excellent learning environment here at Kaiser Permanente San Diego. We hope that you give us some consideration, and we look forward to meeting you.